Hello, my name is Dr. PhD Oscar Wang MD. I am a specialist cardiosurgeon who has operated on many important people. I am doing this course OLE 1500 because I am very interested in cardiovascular diseases. You should all listen to me because I am a doctor and MD and PhD. Today, I will be discussing the rising threat of cardiovascular diseases and what we can do about it. According to the World Health Organization, cardiovascular diseases are the #1 killer on the planet. Of the 57 million deaths we had in 2016, 18 million of those people died from cardiovascular diseases. This is a global issue, and its presence and treatment varies across nations. In developed nations, such as Australia, many lifestyle choices such as excessive diets, obesity, and physical inactivity increase the odds of cardiovascular diseases from occurring. Conversely, in poorer nations, these issues are not so prevalent. However, their detection and treatment are incapable of managing this growing pandemic. Of course, there are many other factors that affect all groups, such as
Tobacco use.
alcohol use and consumption of highly processed cholesterol-laden products. This issue is important because cardiovascular diseases are largely preventable and treatable, but poor lifestyle choices and lack of awareness leads to millions of unnecessary deaths every year. Since you people are Australia's policymakers, I propose that we increase funding to allow for educational campaigns to increase the awareness of cardiovascular diseases. How many times has someone felt their left arm go numb and ignored it? How many more times will we have an unnecessary death? This funding will help us educate and further fund cardiovascular awareness and research. It is imperative that we understand the issue as soon as possible. This not only benefits our people, but makes the government look good for the next round of elections. There is a trend of increasing heart disease deaths in Australia, and it's best if we nip this problem in the bud. Cardiovascular diseases cause 1,100 hospitalizations every day, and it kills a person every 90 minutes. It is our responsibility to fund this issue until it's gone. We must educate the Australian people on this problem. This will alleviate the stress on our healthcare systems, and the victims of this killer can be knowledgeable enough to avoid being targeted and to know when they are being targeted. This will help us reduce deaths and save money in the long term. So please,
Give us money.
This has been Oscar Wang, Doctor, PhD, and MD. I hope you can see purpose in funding
Cardiovascular disease research.